I'm suffering from thinning hair. Does a new procedure called ACell plus PRP really work?
Thank you for your question. You state in your question that you have thinning hair and you're asking, does this new procedure with ACell and PRP really work? Well, I can certainly give you some information about this, quote, new procedure. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and I'm actually the founder of TrichoStem Hair Regeneration Centers, where we perform non-surgical regeneration of hair for people with both men and women with thinning hair using ACell and PRP. So I'll give you a little bit of understanding of how we developed our treatment and give you a sense of the benefit. So to begin with, when ACell, this is a material that is a type of what's called extracellular matrix. And what it is it's a material that's derived from pig bladder that is used for wound healing. Now, the process of use of ACell was first introduced during hair transplant surgery. And the purpose was to improve the survival of hair grafts and to improve the healing of the donor area where you harvest the hair. A side effect that was noted was that thinning hairs occasionally appear to get thicker. Now, this was going back several years, and so at that time I started to ask a different set of questions. And what I wanted to know is, if someone has thinning hair, are we in fact helping them more by figuring out the best way to deliver ACell PRP without doing a hair transplant? In other words, when you have a certain population of hair, chances are if those hairs got thicker, then conceptually you can get better coverage than you can with a hair transplant. So over several years, me and my team and my practice, we developed a system and a process. And how do we do that? Well, we've looked at dosing, we looked at different types of hair loss, we looked at different ages, we looked at different patterns, and essentially over time developed an algorithm. So we refer to that as hair regeneration. Now people come to us from all over the world to have this treatment. And so from that we developed TrichoStem Hair Regeneration Centers as our first effort to try to see if we can bring this process closer to people who can't get to us. So right now there's some confusion, but at the same time I'm very happy about the growing awareness of ACell and PRP. When I was first doing this as a standalone procedure, I can tell you we got a lot of resistance, both from people who were doing hair transplants who felt financially threatened by the procedure, and as well as consumers or people who were circumspect or suspicious about something that works as well as it appears to be illustrated. So over time, basically, we were able to organically prove with a large volume of patients and with people coming to us from, as I said, all over the world, it became difficult to refute the potential benefits of ACell and PRP. The challenges that we faced in the development was in proper dosing, delivery, and dealing with a lot of the challenges of inflammation as well as with shock and hair shedding. So at this point we have systems in place. So I can comment to your question that in our hands, in our practice, it has been extremely successful. Like I said, it is our first line of treatment. As far as I'm concerned, hair regeneration, and from what we've observed, results from hair regeneration can potentially exceed the volume correction and the volume impact of not just one but 2 hair transplant surgeries. Now, of course, this is not a perfect procedure because the limitation is the inventory of existing hair follicles. So if you come to us completely shiny bald and you want to see hair, well, hair transplant will probably be more of an appropriate choice. But as long as you have hair, then I feel strongly that even if you consider hair transplant at some point, stopping the progression of hair loss is critical. So what, and I should actually define what we're able to do with hair regeneration or TrichoStem hair regeneration. For 99% of men and women with thinning hair, we're able to stop progression of hair loss. We're able to reactivate hair that has been not growing because of a prolonged sleeping phase known as the telogen phase, as well as induce the shed of thinning hair and then the growth of thicker hair. Now, as far as the treatment protocol, currently we basically are able to accomplish 5 years of correction based on the quantity of data we have for the majority of our patients with 1 injection. Now, a certain select group we will re-evaluate at 15 months and do another injection. And so it is customized. It's customized to the individual. It's not a one-size-fits-all procedure. And that's one of the challenges that we face in trying to scale this procedure is in properly training another doctor as well as staff in how to implement this procedure. I always tell our patients who want to learn more about this is that it's not like dosing like you would with Botox or with a filler. You actually have to have an understanding of the biologic response, and it's a long view. You don't just get the response immediately. Everyone has different types of growth cycles, and everyone responds on their own timeline. Sometimes I compare it to building muscle by going to the gym. Not everyone gets the same result, and everyone's program has to be customized for them. So I think that you have enough information to decide if this is worth pursuing, but I can certainly state from probably one of the largest volume of patients who've been treated with this treatment in our practice that it is a very, very promising treatment, and certainly in light of the current concerns about the long-term sexual side effects of finasteride, for men it has been a great option, and I would say even more significantly it's been a great alternative for women. For men, there are a certain percentage of men who can also get transplants, but since women have more diffuse hair loss, it is generally understood that women are not typically good candidates for hair transplant, but 99% of the time they're good candidates for hair regeneration. So I hope that was helpful. I wish you the best of luck. Thank you for your question.